Hi, I'm your host, Amy Freena. For over 30 years, CareCredit has been enabling people just like you to get the care, procedure, or surgery they want or need when they want it. Behind the thousands of amazing testimonials we receive from our cardholders are the dedicated providers and healthcare workers who make these stories possible. In this series, we are giving you exclusive access to these well-respected and renowned care experts who are all part of our CareCredit network and asking them to share the information and answers you need to make informed decisions about your health, wellness, and personal care. We have joining us Dr. Thomas Taylor, who is going to be telling us all about liposuction. Dr. Taylor is a plastic and reconstructive surgeon with a private practice in Pasadena, California. He received his medical degree from Columbia University and completed his residency at UCLA Medical Center. He's not only board certified in plastic surgery, but is also a fellow of the American College of Surgeons. Dr. Taylor's surgical achievements have been featured in several local and national media outlets. Hi, I'm Amy, and we are joining you live from the studio today with Dr. Taylor, who is going to give us some insight on liposuction. How are you today, Doctor?
I'm fine, Amy. Thanks for having me here to talk about liposuction.
Absolutely. So before we get into lipo, we wanted to kind of get to know you a little bit. So can you tell us a little bit about your journey to plastic surgery?
Well, I guess I'm one of those rare people that started thinking about being a surgeon actually at a very young age, probably ninth grade.
Wow.
I always wanted to be a general surgeon, and mainly because one of my neighbors was a general surgeon, so he kind of took me under his wing, and I wanted to be like him, and I maintained that focus all the way through, halfway through my general surgery residency at UCLA, during which time I was exposed to some plastic surgery and immediately fell in love with that, and then kind of changed my career path towards that. And I stayed in LA. I'm from Boston originally, and moved to LA to do my surgical training. And I got married, had kids, and ended up going to USC for my plastic surgery training.
Excellent.
And then I went into private practice after I completed my fellowship.
Wow, that's a lot of school.
It is. I'm tired just even talking about it.
Really? Okay, well, we'll move on. What about your hobbies? What are you doing when you're not working?
I have two hobbies. Actually, probably my biggest passion is competitive swimming.
Really?
Yeah, so I've always been into working out and exercising and trying to maintain a healthy lifestyle. And I swam in high school and college, and then having a family and in all my surgical training, I kind of fell out of that for a little while. But probably about 10 years ago, I got back into that. So now I'm a member of the Rose Bowl Aquatic Center Masters team.
Fun.
And so I do national and international competition.
Wow.
And to just blow my own horn, I'm the world champion in the 60 and over, 100 and 200 freestyle events.
Congratulations.
So I'm going to Tokyo next year to defend that title. So
kind of a big deal. We'll wish
yeah,
you luck.
Thank you. So I enjoy it. I try to get the ladies in my office to follow my role in promoting health and wellness, and they're getting there.
They're getting there?
Yeah.
No medals yet.
No medals.
So you said you had two hobbies. What was number two?
Photography.
Really?
Yeah,
What
I
do you
really
shoot
enjoy.
typically?
I like doing travel photography and nature and animals and just it's a lot of different things actually. And it's, I guess I wouldn't call myself artistic in the sense that I can draw well, but I have a very good eye for what looks nice and what's aesthetic and what's proportional, and a lot of that comes out in my photography.
Right.
So I do enjoy it as kind of an art form, less as a kind of a documentary thing, but more like creative and artistic photography.
Wonderful.
Yeah.
Can you share with us one of your most interesting cases?
Most interesting cases. Well, that's a tough one, because there's a lot of very interesting cases, but what's kind of relevant today, I guess, is not that I do too much transgender surgery, but there was a situation probably 15 years ago where I was doing a breast augmentation on this young lady, And it wasn't until after surgery that the recovery room nurses noticed that this was actually
Not a lady.
not a lady, and had his or her private parts still, which I never bothered to discuss or examine,
Wow.
obviously. And it led to a very interesting discussion about the whole transgender community. And because before that point, my experience with the transgender community had not been overly positive. It was mostly in emergency room situations and a lot of issues that go along with it. But I didn't realize that there's a entire sort of subculture of very normally adapted transgender people that are just like you and I and have every right to do whatever they want to do to their bodies to make them feel better and to improve themselves. So that opened my eyes, and and then I started doing a little bit more of that. But that's just one case that just popped in my mind when you said that.
Well, I would say interesting, and that's what I
Yeah.
asked you. So, what would you say then, doctor, is the most rewarding part about your job?
The most rewarding, I thought it would be me feeling like I did a good job,
Okay.
getting a good result, which does give me a lot of satisfaction. But that doesn't always translate to patient satisfaction. You would think
Okay.
it would,
Right.
but cosmetic surgery patients sometimes can be, a little pickier than I am in terms of results. And so even if I do a good job, if they're not happy, if I don't see a smile on their face, that isn't very rewarding to me. But if I see them come in and they have a big smile, and they're happy, and they, either verbally or with body language express that they're happy, that to me is very, very satisfying.
I bet. What about the most interesting place you've ever been?
Well, I've been a lot of places around the world. And a lot of it is related to photography travel. I do a lot of traveling with National Geographic and things like that too.
So it's more than a
Interesting
hobby.
Well, it's still a hobby.
Sounds
It's
like
a
a little more
passionate
than a-
hobby.
Okay, there we go.
Put it this way: if I could make the money I make as a plastic surgeon being a photographer, I might
You'd be
consider
there.
a switch.
All right.
But interesting. I'd have to say probably Vietnam. I found to
Okay.
be very interesting.
I bet.
It was just a very interesting culture, and the people were extremely friendly. And from a photography standpoint, there was just limitless opportunity
I
to
bet.
do a lot of interesting and creative things.
I bet. You're very creative. I'm picking up on that.
Yeah, and my kids have kind of, all of them actually, have kind of followed. None of them want to go into medicine. I think
Okay.
I don't know if I blame myself for that, but exposing them to all sorts of, runs to the emergency room in the
Right.
middle of the night. In fact, my oldest son, who, when I was first came out of practice, and I was doing a lot of emergency room things. My son Kyle was probably 4, 5, 6 years old at that point, and I used to drag him to the ER like all the time because if we were out doing something, I'd call, I'd go to the ER.
Right?
I think I traumatized him because
doesn't-
he is scared of the sight of blood. He just doesn't want anything to do with blood. So he's a graphic designer.
Okay. It's a
so-
little safer.
little safer. Yeah. But all three of them actually like photography, and all
Really?
three of them are very creative in their own ways.
Awesome. Well, they get it from their daddy.
Yeah.
All right, so we're going to move on because everyone is definitely tuning in because they want to hear and learn about liposuction. So first and foremost, what is it and what areas of the body can it treat?
Well, liposuction is the most popular plastic surgical procedure in
Okay.
the United States, probably the world. Injectables and Botox and things like that, number-wise, is a little bit more, but as far as surgery is concerned, liposuction is the number one procedure. And really, in a nutshell, it's sucking out fat from under the skin to contour and reshape the body in that area. Now, what areas you're talking about? Really, I've liposuctioned people from their ankles to their, their temples.
Really?
Yeah, and pretty much everywhere in between. The most common would be, tummy, hips,
Right.
and thighs, but it's really wherever there is fat and it can be removed safely, then liposuction is a potential option for them.
So kind of to keep going in that direction, who then is a good candidate to have liposuction?
Well, the best candidate, and unfortunately they're not the most common candidate, but the best candidate is someone who diets, exercises, they maintain a good healthy lifestyle, and then they will have what we call diet resistant, exercise resistant pockets of fat.
Right.
And they can kind of control most aspects of their body, but these areas, it's a very genetic thing. And so they come in for help for those areas. Now, having said that, probably the more common person is someone who doesn't want to diet, doesn't want to exercise, and
Interesting.
yeah, there's a lot more of those than the former, but that would be the ideal candidate. And
Okay.
someone younger, because the younger you are, you have tighter skin, and there's two main criteria for a good result from liposuction: how much fat you can remove, and then how well the skin will shrink. Because when you remove
Got
the
it.
fat, there's a cavity there, and the skin has to shrink.
Right.
And when people are older, they've had lots of babies or big weight gains and weight losses, the skin won't shrink as well. So, younger person, healthy lifestyle, diet, exercise, resistant fat pockets, that's the best candidate.
Good to know. Is it a viable option for someone out there who is looking to lose weight?
Uh, it's not a weight loss surgery, it's
Okay.
a contouring surgery.
Okay.
We do have patients who come in and specifically will ask, how much weight will I lose? And I can estimate when I do an examination of about how much fat we're going to remove, and I translate that to how many pounds that may be, but then I'll reinforce them and say, but this is not a weight loss procedure.
Okay.
It's a reshaping and a contouring
Okay.
procedure.
Can liposuction then be used for breast reduction or gynecomastia?
Yes, we do that. Not so much breast reduction, gynecomastia for sure. I would say 9 out of 10 gynecomastia cases are done with some type of liposuction.
Okay.
Breast reductions, I've done some. The problem with a breast reduction is most women with large breasts have sagging issues as well because of the weight. And if you just liposuction, you're going to correct the size, but you're not going to correct what we call the ptosis, the sagging of the skin. And therefore they need some type of a lift. And so a breast reduction really involves removing breast tissue and lifting the breast, which you can't do with just liposuction alone. So the times I do it, it's usually a younger person, a teenager who has large breasts. They haven't had them long enough to really sag very much, so you can sometimes get away with just liposuction.
Got it. How much, I'm sure, depending on the area, but how much does it typically cost?
A breast reduction procedure?
Liposuction,
Oh,
I'm sorry.
liposuction. That, it really depends. Most surgeons charge by area,
Okay.
or how much time it's going to take to do the
Okay.
procedure. So if you came in and said, I don't like the fat on the inside of my knees,
Okay.
I mean, that is something you could just do in the office, a little local anesthesia. There's no anesthesia fee. There's really no real operating room fee. So, $1,000 or something like that.
Okay.
Versus someone who comes in who's very heavy, and we're going to do their abdomen, their hips, and their thighs, and their back. I mean, that can be up to $15,000 because they're going to be at a surgery center, they're going to be asleep
Right.
and
It's a
under
bigger-
anesthesia. But I would say the average liposuction cost, at least in our area here, I would say it's probably somewhere in the $5,000 to $8,000 or $9,000
Okay.
range.
And are there payment options available for a patient who maybe doesn't have all the funds up front?
Sure. We offer financing through CareCredit. A few times, way early in my career, I kind of got talked into doing surgery and allowing the patient to pay me afterwards, which never worked out well. So we kind of drew the line at that a long time ago. But when you're young and you're just starting out, you know, you're pretty desperate to get a patient, and so and they sense that, and you know, there's a little manipulation there, and then you learn from your mistakes.
We're done with that.
Done for that, yes. We do have some patients that use us as a bank. They don't trust themselves to save their own money. So they will pay us every month or two until their balance is at a point where they can have the surgery done. In fact, tomorrow I'm doing a rhinoplasty on a girl who's been saving up for over a year now for her nose. But CareCredit has been wonderful. We've used some other financing companies way in the past, and there always seem to be some issues with them. But I would say CareCredit has been really quite seamless and very, very easy to deal with, and they are very flexible.
Well, you know, we're happy to hear that. So let me ask you, when someone has decided, okay, I'm going to have liposuction, how do they find their surgeon?
Oh, that's, yeah.
So obviously you're getting online, you're Googling, and you're getting referrals, but what should they be looking for specifically in a surgeon?
That's a better question.
Yeah.
A patient really needs to find a surgeon who is adequately trained, has their board certification, which gives validity to their training, and has a lot of experience in that particular procedure. Now, that's easier said than done because there is a lot of misadvertising out there, and it's tricky because in many states the laws are quite strict, and what you can do is very restricted based on your training. But in California, I call it the Wild Wild West. If you have an MD after your name, you can do any procedure you want. It's really the burden is on the patient to figure out who the heck they're going to. And doctors and surgeons will misrepresent themselves and by claiming they're a member of some fictitious board or whatever. So I would say the best way is to research and find out if the doctor is a member of the American Board of Plastic Surgery.
First and foremost.
First and foremost, how long they've been in practice, and do they do a lot of liposuction? I have a very good friend that I see at the surgery center that I go to a lot, and he does pretty much only rhinoplasty. And he said he hasn't done liposuction in 10 years. So yes, he's board certified, he's a very good surgeon, but you know, he's probably not one that one would want to pick for liposuction. On the other hand, I don't do that many rhinoplasties. So if someone has a complicated nose problem, I'm probably not the best one to pick for that. So it does take some due diligence on the part of the patient, but American Board of Plastic Surgery is probably the best place to start.
Now, you mentioned their experience. How can a patient tell if their doctor is experienced or not? Are we talking numbers? Are we talking referrals, reviews?
Yeah, all that. I think a lot of it, the patient has to come into the office and really meet with the surgeon and meet with the staff in particular, because anyone can really portray themselves really however they want. I mean, look at like an online dating service. I mean, you can put these crazy photos of yourself, and they're not real, you know. So you could go make a website for a plastic surgeon and put all sorts of photos that have been doctored, and the lighting is different and whatnot, and you're not really getting a good idea of the quality of that work. Now, on the other hand, coming to the office and talking to me and talking to my staff, again, there's got to be an element of trust, because it is hard for a patient to know exactly, you know, I can tell them how many surgeries I've done, but they have to trust me and believe me when I say that. A lot of in fact, most of our patients now are word of mouth, and that's the best referral source, because then they can talk to their friends and say, well, I had that procedure done, and this is how I was treated, this is how the staff treated me, this is my whole journey through this process, and it's a much more objective way for them to make a decision.
Okay. What should the patient expect to experience during the initial consultation?
The initial consultation, there's several steps. The first is just coming into the office. Actually, the first step is the phone call.
Right.
And I have two front desk ladies, one of whom is here, Karina, and my other lady is Gina. And they are both really, really friendly on the phone and very, very helpful. And I can't tell you how many accolades we get from patients talking about how friendly my staff is, and
That's
was like a big reason why they even decided to come into the office in the first place after making multiple phone calls.
Right.
So the first is just greeting them, bringing them in, getting them all set, paperwork-wise and all that. And then I meet them, go through a consultation, examination, and then they will go to my nurse's office, who's my cosmetic surgery consultant, and then she goes through all the financial aspects, scheduling, more technical questions, and then hopefully they book for surgery, and then they become a pre-op patient at that point.
Awesome. Are there particular questions that the patient should ask the surgeon during this consultation?
Yeah, I would ask several things. What is your training? Are you board certified? And always ask, what are you board certified in?
Right.
Because I know in Pasadena here, there is an individual who's board certified, American Board of Psychology or Psychiatric Medicine, doing plastic surgery. Another one, American Board of Emergency Medicine, doing plastic surgery. Again, this is California, so it's very, very loose and easy here. So that doesn't really, so they claim, they can say they're board certified, but you have to ask in what? And then how long you've been in practice, and what is your, what are the numbers, like what percent of your procedures are liposuction versus facial surgery, for instance, something like that.
Gotcha.
And then very importantly, where you're going to do the surgery and, what is the anesthesia going to be like and those things, because probably of all plastic surgery, liposuction is the one that's considered by many to be the easiest procedure, which is why a lot of non-plastic surgeons are doing liposuction, a lot of OBGYNs and dermatologists, and they're doing most of that in their office operating rooms. So, and there's nothing wrong with that. I do a lot of my liposuction in my office operating room, but patients need to be aware of exactly what's going to transpire. They give you under general anesthesia, they give you a hospital, surgery center, office, and what are the safety measures that will be employed in case there's a problem. How close are we to a hospital? Have you ever had to take anyone to the hospital? Have you ever had a major complication? Those type of things.
So definitely ask all these to the surgeon right away.
Absolutely.
Can you tell us about the risks and complications then that are associated with liposuction?
Yeah, I would say the number one complication is it's more cosmetic than anything. It's skin irregularities, residual fat in certain areas. Getting an uneven or an unsmooth result would probably be the most common complication. Infections, I don't even know if I've ever honestly had a liposuction infection. It's extremely rare. I've never had anyone bleed, although you hear of that sometimes. You do hear of disastrous complications where people have died. It's almost 100% when it's done by a non-fully trained individual doing this procedure in a office situation, usually in combination with other longer procedures, and adequate hydration is not done, because when you do liposuction, you're removing a lot of fluid, and you have to hydrate these people, or you can get blood pressure drops and things like that. So again, there's a perception out there that liposuction is very easy, but you have to know your anatomy. There could be catastrophic consequences if you push that liposuction cannula into the wrong place, and you got to be prepared to handle those complications if it happens.
Of course, absolutely. Are there any steps that the patient at home can do to prepare themselves for liposuction? Like maybe the week leading to up to
Yeah, I
it?
would just, well, first of all, any surgical procedure, we tell them not to take any aspirin or Motrin, Advil, anything that can cause blood thinning. So that's kind of general for any plastic surgery or cosmetic procedure. Um, and you should be nutritionally in good shape. And the other thing would be their weight, because I get a lot of questions like, should I lose weight prior to surgery? And I always say you should have your weight at a easily maintainable level.
Okay.
If you're overweight and it's situational, it just happened 6 months ago because there was a death in the family or whatever, and you're depressed, you've been eating, then it'd be good to get back down to the weight that you're normally at. If you diet and do liquid diets and all this crazy stuff to get down to a certain weight and you can't maintain that weight and you do liposuction at that weight, as you gain weight, a lot of this fat is going to come back. And it may come back in different areas than where you did the liposuction.
Interesting.
But if you have your weight set at a place you can maintain, you do the surgery, and then if you lose weight afterwards, you're only going to look better. And it allows you to take out the fat that was, at a higher weight, you can take out more fat. So you just don't want to be at like a morbidly obese weight or an unusual. You want to be at a weight that you're comfortable with.
Gotcha. Can you explain the various techniques that are involved and used to perform the surgery, and who's a good candidate kind of for each one?
Well, there's a lot of different types of liposuction, and they all have in common the ability to remove fat.
Okay.
But I would say all the techniques vary in how the fat is removed or how it's dislodged and loosened to make the fat come out easier. So they all have some type of a vacuum system where you're aspirating or sucking out the fat. Now, a lot of people are under the impression that fat is sitting under your skin and it's like Jello, and you put a tube in there and it just sucks right out.
Right.
Well, think of fat more like a beehive, a honeycomb, and the fat is kind of it's all in these little pockets that have to be broken to be able to remove that fat. So standard liposuction, which began back in the 80s, it was very I don't want to say barbaric, but it was in a way. The cannulas, the tubes were very big. We didn't use any type of preparation beforehand in terms of injecting fluid to numb the area or to vasoconstrict the area, something we call the tumescent technique. They just put the person to sleep, put these big, large tubes in, and just used elbow grease to suck out this fat. And, it was, the results, it was a new type of procedure, and the results were encouraging, but there was also a lot of recovery, a lot of bruising, and you could only do limited areas at a time because there was so much bleeding. So now, the things that have evolved over the years is, number one, the tumescent technique, where we always infiltrate the area first with a medicine or a fluid that loosens up the fat, numbs the area, and vasoconstricts all the little blood vessels. So now when you do the procedure, nice golden yellow fat comes out, and you can do much larger areas of the body because you're not losing blood, plus there's a lot less bruising. And because there's local anesthetic there, a lot of this can be done with the person completely awake or just mildly sedated. But a lot of the technology has been centered around how do we disrupt this fat? How do we get it out better? Do we use ultrasound to disperse the fat? Do we use what we call power assist, like a vibrational type of mechanism to remove the fat? Do we use lasers to take out the fat? There's something called water jet liposuction. We use high pressure water to break open the fat.
Wow.
And I would not say, I'm a firm believer that there's no one system is better than the other. And there are occasionally patients that come in and will say, Dr. Taylor, I'd like to do laser lipo. And then I'll say, well, I don't do that. And I explain why. And they're like, well, I'd really like you to do that. And then I say, you don't want me to do that because I don't have any experience in that. You want to pick a surgeon who has a technique that he or she is comfortable with, And that's the technique you want to use. Because really, I think a lot of this is in the hands of the surgeon.
Right.
And I tend to use vibrational power-assisted technique, and I can put my results up against anyone who uses laser technique, or they use the ultrasound technique. So the newest rage in technology is a complete 180. Up to now, most of the money spent on R&D and body contouring has been, again, how do we get more fat out?
Right.
But the big elephant in the room is what's going to happen to the skin. And so now there's a lot of talk and money and new technology being developed for tightening the skin after liposuction.
Okay.
And that's basically using radio frequency energy. After you do the liposuction, probes are put under the skin to heat it and shrink the skin and build collagen, which gives a much tighter result than they would with just, fat removal alone. So that's kind of where technology is going.
That's exciting. Good to hear.
Yeah.
So you kind of touched on this already, but can you tell us how the procedure is performed?
Yeah, so a patient could either be asleep or awake or in between.
Okay.
And it depends on the person, probably most importantly, the patient.
Yes.
And how big of a person they are and whether they have health issues or whatever. But once they're ready, or even before that step, we have the patient dress, we take pictures, we mark, and I always do it in a mirror so they can see where I'm marking, so there's no question about what areas are being done. And then they are brought to the operating room, and sometimes they're cleaned while they're laying down. A lot of times we do what we call a standing prep, where they're standing and we circumferentially, the nurses clean them. Because when they're having liposuction done, usually they're being turned in multiple positions.
Okay.
So it's a lot easier to just clean them standing up, put a sterile towel down, sterile drapes, and then we just kind of turn them on the table. It's much quicker and easier that way. And then multiple little poke holes are done depending on the areas that are being treated. The one thing about liposuction is it's basically scarless. There's a few small little poke holes. They're almost always hidden in little areas like in the belly button and under the buttock creases or in the groin creases and in the armpit and stuff like that. And they're very, very tiny. And then the part that they may feel if they're awake, it's the injection of that tumescent fluid, which is a very important first part of all this. And so there's a little bit of stinging, but again, most of these patients are sedated or asleep. And once the tumescent fluid is put in, and we wait 5, 10, 15 minutes, and you can see the skin just blanch white. And that's sort of the sign like, okay, we're ready to go.
Okay.
And then we do the procedure. Again, we may roll them in different positions, and when we're done, little stitches in the little poke holes, and then we put them in a very tight-fitting liposuction compression girdle that they wear full-time day and night for a few weeks, and then they kind of taper that off over several more weeks depending on the swelling.
Okay. What can the patient expect to experience during recovery then?
Soreness, that's the big one. Liposuction is a very rapid recovery in terms of getting back to doing your activities of daily living.
Okay.
Meaning after 4 days, I let people do whatever they want to do.
Wow.
Now, that doesn't mean people are going to do everything that they did before, because they're going to feel sore. They're going to feel very, very bruised. They may look a little bruised, particularly thighs bruise a lot, but they're going to certainly feel sore. When they bend or turn or twist, they're going to feel tight, but they cannot hurt anything.
Okay.
So in 4 days, I make people wait 4 days to take a shower, because the girdle is put on very, very tight, and then they swell. The swelling peaks in 2 days.
Okay.
And if they took it off, they'd never be able to get it back on again. So we make them wait 2 more days. They feel the girdle loosen a little bit, then they can take their shower, wash and dry the girdle, put it back on, and then I tell them, if you want to go run a marathon, go run a marathon.
Wow.
Most people are other than walking, don't do too much for a week. But the reality is they can drive within several days. They can get back to work very quickly. They can really do most things. The hard part about a liposuction recovery is the swelling. Because it can generally take up to 6 months, sometimes more, sometimes a little less, but around 6 months to really see a final result. And there's a lot of things we have people do to try to get them to that result as quickly as possible. But that's the is a frustrating thing about patients is a breast augmentation patient, they wake up and boom, they have their new
There they are.
pair of breasts. Liposuction, sometimes people come back in a week and they're like, oh my God, my pants, like the pants I'm currently wearing don't fit because I'm swollen. So you kind of have to talk about all this beforehand so they understand. But eventually, the swelling just slowly dissipates and then they look good.
Do the results change as time goes on? Or is it that after that first couple weeks and the swelling goes down, then it's pretty
Oh no!
consistent?
So I tell people usually at a week or two they're going to look smaller than the way they were to begin with,
Okay.
and then they keep going down from that point.
Wow.
And it takes about 6 to 8 weeks for about 2/3 of the swelling, and another few months for the last third. So they just keep getting better and better, and then as time goes on, the skin tightens more and more. So I don't generally take follow-up photos for about 6 months.
Really?
Yeah.
Is this a procedure that you would have to have done more than once in the same area?
Well, a lot of people do. No, I mean, you would never plan this out because there are times with other surgeries where you would plan something where you're going to do it in stages.
Right.
This is not one of them. But unfortunately, even though we talk about it and we prepare patients and educate them that just because you have this surgery does not mean you can start eating whatever you want and throw your gym membership away.
Right.
And unfortunately, some patients do that, and they gain back some of that fat, and then we do go back and do liposuction in the same area.
In the same area.
Yeah,
Interesting.
not too common, but it certainly happens.
Okay.
And it's a more difficult surgery because they have a lot of scar tissue under the skin.
Dr. Taylor, what about those procedures that freeze the fat? Are those just as effective, similar, different?
It's different. That would be considered a more non-invasive approach to body contouring.
Okay.
Fat cells are susceptible to death by freezing. So if you take a machine and apply it to an area, through the skin, the cold is transmitted, it freezes the fat, and over maybe 6 to 8 weeks, about 20 or 25% of the fat cells will die.
Okay.
And they're just taken away by our immune system, our macrophages and whatnot. But you're only taking away maybe 20% of the fat cells, where a liposuction procedure, yes, it's a little bit more invasive, you're taking away 90 or 95%
Oh,
of the fat
wow.
cells.
That's very different.
It's very different. So I would say those non-invasive freezing techniques is really, the best candidate is someone whose diets, exercise, in good shape, they have some resistant fat pockets they don't like, and they do not want surgery.
Okay.
And there are patients that come in and they'll say, what do you have other than surgery? I don't want any recovery, I don't want any scars, I don't want any girdles, I want to be able to just go right back to work today. What do you have? And that's what we offer them. The results, they can be quite impressive in some people, and others not as impressive.
Interesting.
That's my only frustration is it's not always predictable who's going to get a great result, but it works really well in quite a few people.
Okay, good to know. Good insight. So, doctor, to that patient at home that has been debating lipo for years and years and years, but just hasn't been able to take the first step, what advice do you have for them?
Go take the first step. It's kind of scary, and a lot of patients say, I can't believe I'm here. I've wanted to do this for a couple of years,
Right.
and I was too nervous or whatever. But, there's nothing to lose by making a consultation, going in, meeting a doctor, meeting their staff, which is super important, and getting some good information. There's a lot of good information online, but again, what people post online, you have to take with a little bit of a grain of salt. And
Right.
I think really meeting the staff and the doctor, you're going to get more information. And if you're going to do this, meet with several doctors. I mean, anytime I purchase any large item, I usually shop and price compare and want to meet, different people. And so there's nothing wrong with that. But don't be scared about going in to meet with a doctor. I think, cosmetic surgery is kind of interesting because people are coming in very unhappy and even ashamed sometimes of how they look. And they have to show that very area to a complete stranger. And so they're scared by that. And so usually I will try to disarm them and say, 'cause a lot of times they'll say, "Oh my God, I just don't even want to take this gown off. You're probably gonna faint, Dr. Taylor." And I'll say, "You know what? Whatever you show me, I've seen worse."
Right.
Now, occasionally there is someone who is the worst, but you
Right.
know, it's worth it in the end to face your fears and find some information. And going in for a consultation is the best way to do that.
Can I ask you also, how many of those patients, percentage-wise, that come in and say, "I've been waiting, I'm so afraid," you know, that you can tell they're wound up pretty tight by the time that they get to you. How many of them end up actually going through and forward with the procedure?
Well,
Because I'm sure there's some that say, "Never mind, I'm done."
yeah, but I think there's some of this is inherent in their personality. You know, they're just, or I don't know the percent. For sure it's a smaller percent than the person that comes in with a skip in their step and they're
Right.
so excited and they come to the front desk with this big smile, like, "Oh my God, I can't believe I'm here." Like those, you know, there's definitely a higher percent of those people doing surgery. But
Good to know.
the people that are worrying and scared and concerned, you know, a lot of them will do surgery, but it takes a little bit more time, a little
course.
bit more hand-holding. They're going to have more questions. Those people are not going to just schedule surgery that day. They're going to think about it. Sometimes they come back and they want to do a little Botox or something just to kind of...
To get warmed up.
Yeah, just you know, put their foot in the shallow end of the pool
Right.
and then kind of get ready for it. So,
Okay, that's good to know. All right, Dr. Taylor. Well, thank you so much for educating us on liposuction. We appreciate it.
oh, it's my pleasure.
Before we let you go, we're going to do a quick lightning round where we're going to ask you, I'm going to ask you, not them, this or that, and you just say whatever comes to mind. Are you ready?
Yes, I am.
All right. A cat or a dog?
Cat,
Hard top or convertible?
hard top,
Surf or ski?
ski,
Golf or run?
golf,
All right. Night owl or early bird?
night owl,
Decaf or calf?
calf, for sure.
Shop in store or online?
Online,
NBA or NFL?
NFL.
All right.
Go Patriots. I'm from Boston. What can I
Okay,
say?
we'll stop the interview right now. Okay. All right, well, thank you so much for your time. We appreciate
You're
it.
very welcome.
We learned a lot about liposuction from one of the country's top board-certified plastic surgeons. If you're considering body contouring, we hope we've provided the information that you need to decide if you want to take the next step and schedule a consultation. Remember, CareCredit is a leading national healthcare credit card that can enable you to get many of the surgeries, procedures, and treatments you want now and pay over time with everyday promotional financing on purchases of $200 or more. CareCredit can also be used to pay for copays, coinsurance, deductibles, and your health and wellness needs. CareCredit is accepted at hundreds of thousands of locations nationwide to pay for care whenever you need and want it. If you are interested in applying for a CareCredit credit card or would like to find a provider in your area who accepts CareCredit, visit us at carecredit.com. And if you found this information valuable, please leave us a 5-star review on the App Store and a thumbs up and share it with a friend. I'm Amy Freena with CareCredit, and I will see you soon.